Type 2 diabetes is one of the most significant health challenges in the U.S. Left unmanaged, the disease can lead to serious complications, including heart disease, kidney failure, vision loss, nerve damage, and amputation. Dr. Richard Pratley is joining me now to share details on a new investigational procedure that could help. So thank you so much for joining me. And first, what is type 2 diabetes and why is it such a serious health issue?
Well, type 2 diabetes is the most common form of diabetes. We estimate that it affects about 34 million Americans. That's almost 1 in 10 adults, so almost everybody knows somebody who has diabetes. We care about diabetes because of the long-term complications of diabetes. These include things like heart attack, stroke, heart failure, and kidney disease. And we think that by early diagnosis and effective treatment, we can help reduce the risk of these life-threatening complications.
How does the new procedure work and what makes it different from current treatment options?
Well, as a practicing clinician seeing patients in Orlando, I'm frustrated because while we have many good medications for diabetes, what I see is that I'll start on one medication and then add a second in a year or two and then a third and a fourth. And this really creates a burden for patients with type 2 diabetes. This new procedure is different, and what it does is to target the duodenum. The duodenum is this first part of the small intestine, and it's where nutrients, where food initially comes in contact with the body. It serves as sort of a metabolic control center that allows our body to adjust to the different incoming nutrients. We believe that this procedure helps to address the abnormalities in the duodenum that we see with type 2 diabetes. It causes regeneration of these abnormal cells, and in doing so, it then helps to control blood sugars as well as some of the other metabolic abnormalities in type 2 diabetes. So it's real different than the other medication treatments that we currently have.
What have you learned from the early stage trials?
Well, studies have been going on for over 2 years now. And what we know from these studies is that they're generally safe and well tolerated. Again, it's an outpatient, non-surgical procedure. What we've also seen is that there's good control of blood sugar, as well as lipids and reductions in body weight that seem to be sustained. We believe that this procedure is different because it is either slowing or stopping this natural progression of type 2 diabetes, and therefore it could be an effective addition to our current therapies.
Well, how can people with type 2 diabetes learn if they're eligible and overall get more information?
Well, we invite people to visit our website. That's rectstudy.com, resetstudy.com. We're looking for adults with type 2 diabetes who are not controlled, even though they may be on 1 to 4 medications for diabetes. So if you think you might be eligible, please visit the website and see.
Well, thank you so much for helping us get the word out today. It seems like this could help a lot of people.
My pleasure.
And everyone at home, if you would like to see this interview again, just head to First Coast News Plus.